Hi, I'm Weston Weaver. I'm the pharmacy manager of the outpatient pharmacy of Uinta Basin Medical Center.
Hi, I'm Audrie Wisell. I'm a nurse practitioner here at Uinta Basin Medical Center. I primarily work with the hospitalist program, taking care of patients who stay in the hospital for any reason.
And I'm Angela Gordon. I manage the medical, surgical, and ICU department. I am an RN, and we're also taking care of the patients that do have coronavirus that stay overnight. The reason that we put together this video is because we end up having a lot of repeat questions from the community about coronavirus, how to prevent it, about immunizations and that type of thing, and we wanted to take a minute together to answer some of those questions for you. I know we're all exhausted hearing about COVID, so please bear with us, but we're hoping to get you the answers that you'd like. All right, we get that question a lot, and I guess what I would say is, how do we, when safely caring for family members and friends with COVID-19, we need you to be there for them, because every sick person needs help, and the last thing we would want is for them to be abandoned and alone while they're sick. So what we would ask is you care for them the same way that we care for patients that are hospitalized. So to prevent the spread of infection, what you would need to do is wear a mask. We realize you don't have the same masks that are in the hospital, but some protection is always better than nothing. In addition to that, wear eye protection, even if it's just glasses, sunglasses, whatever you can find. Any mucous membrane you have, if that virus makes it there, then there's a greater chance that you may become infected. What you need to do other than that is remember not to touch your face while you're caring for those patients. And then when you're finished caring for that patient and you leave, that house or that room, it's best to dispose of those things, keeping yourself as clean as possible, and then wash your hands. We'd also recommend when you make it home to your family that you directly wash all your clothes and shower, so that you're not spreading that infection from maybe your hair to your mouth later when we touch our faces all the time, if that makes sense. So just do the same thing we do in the hospital. You don't have gowns, so wash your clothes after you're finished. It's really pretty simple in theory, but it is difficult to stop the spread. That's what we'd encourage.
The patients who we discharge from the hospital, one of their big concerns is how do they get the supplies that they need once they do go home. And if you're able, be that person in the community who reaches out to those people who have been discharged and talk to them about their needs. See if they need you to go to the pharmacy and pick up medications for them. See if they need you to go to the grocery store for them. That can be a contactless procedure where you just leave it on their porch, and it can make a huge difference for them and to help protect the community for those people who have active COVID-19 cases.
It is, nationally and what we're seeing locally. It's not that we don't see breakthrough cases for those who have been vaccinated, and the majority of what's traveling around our country right now is the Delta variant. So there is going to be breakthroughs, that's to be expected, but our personal experience has been that those who have been vaccinated are far better off than those who are unvaccinated and getting the symptoms and a positive test for COVID. So while it's not going to guarantee it's going to keep you from testing positive, that's clearly not the case. What its benefit is helping you not be as sick as you would have been had you chose to go unvaccinated and get the Delta variant.
Yeah, we feel that the vaccine does not always prevent you from getting this disease, but it will definitely decrease the chances that you will die from this disease or that you will become hospitalized. So we personally know of about 2 people that have been hospitalized and have become quite sick, but did fully recover from this disease because they were vaccinated.
Being one of the healthcare providers who is actively caring for these patients who are hospitalized with COVID-19, whether they're vaccinated or not, I can tell you that those 2 patients, I was personally involved with their care. And my personal opinion, and of course there's no guarantee, is that they likely would have died if they had not been vaccinated prior to contracting COVID-19.
It's pretty clear when you look at the medical data that's available, who's showing up in the hospitals, who's having to be admitted, not only in our area but all over the country. Those who are choosing to be unvaccinated are the ones that are the sickest right now, and it makes sense. A vaccine prepares our body for defense against an invader, and in this case COVID. The more prepared our body is when we finally are exposed to that virus, the vaccine is going to be beneficial to us because our body already has a running shot at it and prepared for it to come. Even as the variants show up, there's enough similarity in those variants that you still have protection against Delta, even though those vaccines were developed against the Alpha variant. So again, from personal experience, my family has had, amongst the members of my immediate family, we have experience with all three of the currently approved vaccines. What is in common with all of them, as it is with any shot, even flu shots are going to be this. For anyone who has a needle in your arm, you're going to have some soreness, maybe swelling, and even redness in the area where the injection was given. For us and for those that we've vaccinated in our pharmacy and the experiences that we've heard back from them, that soreness in that arm is going to last for 2 or 3 days. Every vaccine, every shot, every medical procedure has extreme potential side effects, but those side effects are very low. What we're going to see most often is that sore arm, maybe some fatigue, headache, soreness, similar to flu-like symptoms for a couple of days.
Oh, absolutely, the vaccine every time. And the side effects, please try to bear in mind that when you do get those side effects, the fatigue, body aches, things like that, that's an indication that the vaccine's doing its job. You're not sick in the sense that you have an infection. You're just feeling lousy because your immune system is responding to that vaccine, which is exactly what we want. That's what makes the difference in preparing your body to defend yourself against the infection later.
We're finding a lot of the people that end up with coronavirus that end up critically ill, almost all unvaccinated, end up on oxygen for a large amount of time and end up with permanent damage to their lungs, as well as a lot of other complications that I'm sure Audrie could speak to. But yeah, it's not as simple as just am I going to die or am I going to live? The question is, what quality of life do you want after you have coronavirus?
One other thing that's probably worth mentioning is the financial effect. The vaccine costs us nothing to get that right now, and for those that I've seen that have suffered some of the worst side effects that I've seen from the virus itself and having been unvaccinated, the hospital bills, the time off from work, all those other things could have been traded in large part, at least if not even just a fraction of that amount, if they had been vaccinated, by reducing that effect. They may have avoided it altogether. And so there's certainly lifestyle things to consider in whether I get vaccinated or not, but there's a financial impact. As prevalent as it is in our community, chances are we're going to get it. If you haven't been vaccinated, you're going to get it. And the odds are very high that you will. And while you may not know you did, there are some asymptomatic ones that do. I feel really bad for those that have large, long hospital stays because they chose not to get vaccinated with a free vaccine that would have had a little soreness in the arm for a couple of days.
So one of the things that I think it's important to note is that at the beginning of COVID-19 with the Alpha variant, mostly we were seeing the effect in the elderly, and a lot of people really dismissed that. And with the Delta variant, we're seeing younger and younger people hospitalized, people who otherwise consider themselves quite healthy. And they're people who have families to provide for, and they're hospitalized sometimes for quite a prolonged period. We've had a number of patients hospitalized here for over 2 weeks, And for our hospital, that's quite a prolonged hospitalization. That impacts their families in financial ways, as Weston was saying, but it also impacts them in their ability to provide the emotional and social support for their families and their communities. It takes them away from all of the roles that they play in their lives day to day. And that's time you don't get back. And if, heaven forbid, you lose your life, the knowledge that that might not have been completely preventable, but it was largely preventable, is devastating. You know, I look in the eyes of my patients when we're talking to them about intubating them, and they're terrified. The idea that they're going to be put under and they don't know if they're going to wake up. And I always talk to them about what I expect, and that I typically really believe that they're going to live and that the right decision is to intubate them. But they're saying goodbye to their families, not knowing if they're coming back. And that's a really hard thing for their families. And before they've even known that they've been positive for COVID, they've been out in the community potentially impacting large swaths of people who are or aren't vaccinated, who then can face the same situation in the future.
My initial response is anger. A lot of people have wanted to just move on from COVID and pretend that it doesn't exist, which I don't blame them. It's been a really difficult, couple of years that has affected us, well, a year and a half that has affected us financially. It's affected people's employment. A lot of, people, it's affected their ability to choose their freedom. It's been very controversial. But for us in healthcare, this hasn't gone away, and it does lead to a lot of us being very upset, because people, we would never want people to not be able to choose. We want you to always be able to choose whether or not you get a vaccine. That's important. But we're upset with the misinformation you're getting and the sources that you're getting your information from. For instance, a lot of people, what they're doing is it's called confirmation bias. They're seeking information and they're seeking research to confirm what they already believe, instead of trying to disprove what they may believe, to see if it's actually true. So they're looking for social media outlets, for random primary physicians throughout the country that have much less information than the ones that study coronavirus on a daily basis, and the people in your community that have treated hundreds of COVID patients. Those are the people you need to be reaching out to for information, not the less educated. This research is complicated. So when you're trying to decide who to trust for information on coronavirus, you need to ask the most educated person you know, which should probably be your trusted primary care physician, not his medical assistant, and not some random person on Facebook.
As Angela said, probably your best resource is your primary care provider, whether that's your physician, your NP, or your PA. They only have your best interest at heart, and hopefully you have a relationship with them that you feel comfortable going to them and discussing your concerns. And I promise they would never tell you to do something that they think would be harmful for you at all. Other than that, the CDC website has a huge amount of information available to you. It has the studies, it has the statistics. Your state and local health departments have your local and state statistics. If you look at that, it's really hard to see how you can possibly think that the vaccine is as or more harmful than the disease.
The good news about information, though, is that we all now, unfortunately, where it's spiking in our neighborhood, we're seeing, at least at the pharmacy level, far more interest, kind of a lull in things between when it spiked really high for the state back in January, and then where we're seeing it hit us here more now, almost everyone knows someone who's gotten the shot. Almost everyone knows someone who's gotten sick. And there's more data. It's easy to look at one case and say, well, this person got the shot and they had this terrible outcome. And when you don't know anyone who's had the disease with a far more terrible outcome, it's easier to say, well, I'm not going to take my chances with that shot. Certainly there's changes happening in the community for a positive turn. The people have that information now where they know someone. Unfortunately, it's here, and it takes time to build immunity now that you want the shot. But I wouldn't put it off a day to see what happens or how it goes, because there are those financial, those personal, those scary things that come along with getting this virus without any protection at all. Far more better outcomes when at least you have that protection. I always describe it as kind of like the wanted poster in the sheriff's office. When you see this guy, get him. And this vaccine does that. It basically gives our body a chance to identify who the invader is, how do we take care of him and get rid of him that much quicker, as opposed to it showing up in our body having no idea what's going on until we're very, very sick.
On a weekly basis, I am concerned on whether or not my department can care for you when you come into the hospital because of our limited resources. When I say limited resources, I'm referring to supplies, staff, and beds. For you, it's a simple decision. It's, do I want to get the vaccine and am I risking my life? It's not easy for us. We have a responsibility to care for you in the community, and many of you are taking that very lightly. I would really encourage that you seek correct sources, because I promise you, you're being lied to from both the right and the left. And it is very, very sad, because we're all suffering the repercussions of massive lies that are going out. Healthcare should not be political, and it has become that.
I can speak to my own personal, my family loves sports, and for everyone participating in sports at the high school level this last year, it's been a nightmare. Kids who have worked really hard for years and years, and their opportunity their senior year was just gone. They couldn't even participate, or their team had to be eliminated from the state playoff and things like that. There was just small things when you consider the life and the other threats that the virus provides. But for kids who initially were not very susceptible to the Alpha variant, they were not likely to have problems. You can see that statistically, it's pretty straightforward. But their lives were interrupted, and in some cases, that times they missed, they'll never get back. So when it came to that, and within my own family, there was those age level requirements that some of the vaccines have that the other one doesn't. And so as that data came out and as those approvals came, that's why my family got a variety of the different vaccines, is the age difference between the vaccine availability. Every one of my family members is now vaccinated, because fortunately everyone in my house is older than 12 years old. But I want them to be protected, and that's really what it comes down to for a vaccine. I protect myself by getting a vaccine. You wearing a mask has protections, but the biggest thing I can do for myself is get the vaccine. And so for my girls, I can't control what all the other high school kids out in the world do, but I can protect them. And so I have evidence to prove. I believe in it. I know that it's going to protect them. If they were to get sick and have a breakthrough infection, I know I did everything that I could, and I'm okay with that. And if others who through using the information that's available and doing hard research and really not looking at only one or two off type experiences or cases or social media, if you would make your decisions based on more than that, based on gathering as much information you can and then exercise your freedom as you wish, I'm protected. I'm not so much worried about you infecting me. I still am concerned about you not taking care of you, but that again, that's your choice. I just want you to make that choice with as much information as you can get your hands on, and the better that information, the more wise your choice will be.
Just want to speak to, in the hospital, we're doing the very best that we can to take care of you, but you have a part in this, and to some extent, we're all responsible for the choices that we make. All right, so we're seeing a lot of burnout within healthcare, and especially in Utah. When we try to transfer patients to other facilities, what we're finding is that it no longer has to do with bed shortages, it comes down to staff shortages, because nurses are leaving healthcare altogether. And we've never seen as large of a transition as we have since this COVID pandemic started. So just want to, remind community members that, we're all part of this. And when you make a decision to not be vaccinated and not protect yourself, I want you to be aware of the outcomes that you could be facing. You may get to the point where you're waiting in the ED, or when you have a family member admitted to med-surg and they got a bed but you didn't get a bed, and you have to be transferred to another hospital because we may not have the staff to take care of you. In addition to that, you need to know that COVID has an impact on other patients in the basin. An increasing demand for COVID patients is impacting surgical services, and we've had to consider whether or not we're going to have to shut down elective surgeries. And it makes me sad to think that there may come a point again where a patient in pain that needs a knee replacement will not get one because patients chose to not be vaccinated, and we filled those beds with those patients. So please, it's very stressful for us. We haven't been able to let this go because we're facing it on a daily basis. And we're tired of seeing you suffer. We're tired of seeing people die. It's taking an emotional toll and a stressful toll, and it's really impacting the lives of healthcare providers along with this community.
And we don't want you to lose anyone else. And we don't want you to lose another year of normal activity. We don't want you to lose the ability to go on your vacations and make those memories with your families. I support your right to choose whether or not to be vaccinated, but you having that right doesn't mean that you get to choose the consequences of that decision. And because of that, you need to consider that in your metric, the potential complications of not getting the vaccine and what that can mean. And before there were vaccinations, people died of all kinds of preventable diseases all the time. Death is natural, but it's also sometimes preventable. How to take care of patients. But you never get over having somebody ask you who's critically ill, am I going to die? The impact of that never goes away.
Okay.
Our current 7-day average positivity is over 10%. That means we're at a high level of transmission. So anything greater than 10% is a high level of transmission. So Angela, can you talk to us about what our rates have been recently?
In June, we admitted 20 COVID patients and transferred 2. In July, we admitted 34 COVID patients and transferred 5. And August numbers are growing, and we anticipate they're going to be higher than July. What that's not accounting for is the number of patients, the number of non-COVID patients we had to transfer because we didn't have the staffing and or bed availability to care for these patients.
And that's because of the rates of positivity on our testing. Weston, can you talk about our rates of positivity?
So when we test individuals here at our facility, you have a wide variety of people who don't feel well, they're getting tested because they don't feel well. There's others that are getting tested because they got to go to school or to travel. And so it's a small picture of what's in the community, but just for everyone's interest, in June, we tested 1,081 people, and of those, 18% were positive, which is just a little less than 1 out of 5. And it, again, as was stated earlier, it's not going down, because in July it was up to 22%, and this far into August we're still at 22%. So of those samplings, 1 in 5 people, that's generally a household. That's the type of rates that we're experiencing here right now in the Red Basin.
And when you think about that, think back to when we were looking at red, yellow, and green levels of transmission. We're in red, okay? That is as bad as it gets. These are, I'm not sure what our peak transmission rate or positivity rate was in the winter, but it's the highest I remember it being. It is really significant at this point. This is serious, and it's not getting better.
Thank you for hearing from us today. We chose to work in healthcare because we care about our community, we care about your health, and we care about you and your loved ones. So please join us and do your part in utilizing effective research methods and appropriate sources to get your information on coronavirus. And we can make this community a healthier place. Thank you.